Good day, viewers and listeners, and welcome to the COVID-19 update for today, Friday, November 19, 2021. I am Godfrey Brooms. Today, we will be speaking with the Minister of Health, Dr. Frank Anthony, on government trying to acquire vaccines for children 5 to 11 years, and also on the rollout of booster shots for persons 50 years and above, and those with comorbidities that are 18 years and older.
Yes, we do have an adequate supply of PPEs, and by PPEs we mean N95 masks, we mean the hair covers, shoe covers, gowns. We do have adequate supplies of all of these. We have been distributing it to our health facilities across the country. Pfizer has made special vaccination for this age group. So while it's the same ingredients and everything, the packaging has been different. And we have been making efforts to source that. Unfortunately, we were not able to get it in time to start our vaccination as we had intended. And therefore we'll have to defer that until we get those special doses that Pfizer would have made, the prepackaged doses. And once we get that, we'll be able to roll out the vaccination for children between 11 to 5. So as of now, we'll have to wait until those special vials for children 11 to 5 come into Guyana. We have concluded, based on data from and recommendations from more stringent authorities, that a booster shot is necessary, because what that data has shown is that after 6 months after the second dose, so if the regimen is a 2-dose regimen, 6 months after that second dose, that the immunity starts to wane. And therefore, if the immunity starts to wane, the chances are that persons can get infected, they can be breakthrough infections, and the protection that the vaccine would normally offer for persons, preventing them from getting a severe form of the infection, that can start to wane. And so, out of an abundance of caution, what we are going to do from next week is that we want to make booster shots available to persons 50 years and above. So anybody, once you pass 50, you can come into any one of the vaccination sites, and we'll be able to give you a booster if you would like to get a booster. So 50 years and above, you would be eligible for a booster dose once that 6 months would have passed since your second dose of a 2-dose regimen. So that's one category of people. The second category of persons, if you are below ages 50 but up to ages 18 and you have some form of comorbidity, then you can get a booster shot. And when we are talking about comorbidities, the CDC has classified a number of conditions as comorbid conditions. So we are using that classification, and that classification includes persons with cancer, persons with cerebrovascular diseases, there's people with strokes and things like that, persons with chronic kidney disease, person with chronic lung disease, so if you have some pathology in your lung, persons with chronic liver disease, cirrhosis and so forth, persons with diabetes, whether it's type 1 or type 2, persons with Down syndrome, persons with heart conditions, such as coronary heart disease, cardiomyopathies, and so forth, persons with HIV, persons with mental health disorders, people with depression and so forth, persons with neurological conditions, including dementia, persons who have obesity, persons who are pregnant or recently pregnant, persons who smoke, persons with sickle cell or thalassemia, persons who would have had a solid organ transplant, persons with substance use disorder, persons with tuberculosis. These are considered as comorbid conditions. So any one of these persons, if you have such a condition, then you're eligible for a booster. As you also know, we have been administering the Johnson & Johnson vaccine, and with Johnson & Johnson vaccine, the requirement after the first dose, you can be eligible for a booster dose 52 days after. So this is something that is now being offered, so you can get with Johnson & Johnson for a shorter period of time, 52 days after. With the others, once you have completed a 2-dose regimen, then you can get a booster shot 6 months after. In some cases, it can remain the same. So if you had 2 doses of Pfizer, you can get a 3rd dose of Pfizer. With some people, they would like to have mix and matching. So if you had 2 doses of AstraZeneca, some people might want to have 1 dose Pfizer. So we'll put out that schedule of possibilities, how you can interchange these vaccines. So that by Monday we'll have that out in the public, and therefore as people go out to get their boosters from Monday, that information would be available. Persons who have received their vaccines so far, as of yesterday, we have had for first dose 394,759 persons receiving a first dose vaccine. That's now 77% of our adult population. We've had 267,421 persons who would have received a second dose vaccine. That's now 52.1% of our adult population. Again, as I've said yesterday, for the 12 to 17 age group, first dose Pfizer is 28,604, and second dose Pfizer is 19,796. This is still low. This is a one-off incentive in recognition of the heroic work that healthcare workers would have done over the period of COVID. As you know, we had our first case of COVID on the 11th of March 2020, and since then healthcare workers have been extremely busy working on the front lines, ensuring that people are safe, giving advice, educating people, vaccinating people, treating people, and a lot of personal sacrifice. You know, they really give up a lot. And I think as a country, we are extremely grateful that persons would have stepped up and being able to do this and keep us all safe. So in recognition of this great work that they've done, the government of Guyana has allocated $400 million as a little incentive to show our appreciation for the good work that they have done. And so that that is really the genesis of the $400 million. And I think it's really appreciated by all those who have worked so tirelessly over these last few months.
And this has been the COVID-19 update for today. For more information, you can visit the Ministry of Health's website at health.gov.gy, DPI's website, dpi.gov.gy, and our social media platforms. Godfrey Brooms is saying goodbye for now.